Hello everyone, I am Dr. Bisma, trainee endocrinology, currently practicing in UK. Today I am here to provide you with an in-depth step-by-step guide to the specialty certificate exam of diabetes and endocrinology. This is especially useful for the doctors who are going to appear for SCE, endocrinology and diabetes exam. Just a headline of the video, we will go through these important steps. First, to understand the SCE exam structure, then the eligibility requirement, exam schedule and the venue, application process, time frame, exam format, question distribution, recommended study sources, supplementary learning, proven tips for the success, and finally what would be the procedure following your what would be the expectations following your exam. So first, to understand the SCE exam structure. SCE it is a computer based exam which is conducted by the Royal College of Physicians to evaluate your expertise in diabetes and endocrinology. This exam is recognized not only in UK but also in other countries like Ireland, Pakistan, India, Middle East, and it shows your abilities and your expertise in the field of diabetes and endocrinology. So if you're someone who wants to excel in your field, then you should appear for the exam. This is this is MCQ based exam consisting of two papers. Each paper has 100 single best answer questions, and there are a total of 200 questions. We will go into the details further ahead. So next is the eligibility requirement. This eligibility requirement have recently become very simple. Previously you needed MRCP, either part 1 and part 2 exam, to appear for this exam, but currently they have changed the criteria. Anyone who is interested in diabetes and endocrinology from international medical graduate, they can appear for this exam. But in UK it is taken by the diabetes and endocrinology trainees. So you need an MBBS or equivalent with experience in internal medicine or endocrinology. You don't need to be UK based. There are no restrictions on taking the SCE exam. However, UK trainees would usually take it during the penultimate year of their higher specialist training, and international candidates are advised to take the SCE at a similar or later point in their training. You may hold an MD or MBBS degree before attempting this exam. You do not need to have any MRCP exam prior to taking SCE. So it is a mandatory exam which the UK trainees need to give in their higher specialty training before finishing their training. But otherwise, international medical graduates who are interested in diabetes and endocrinology and want to update their knowledge, then they can sit for the exam as well and can have a degree in the specialty. Next is the exam schedule and venue. Previously the exam was conducted twice in a year, but recently the exam schedule has changed. Now it is held once in a year, usually in September to November, conducted globally through the Pearson VUE Center. So all the exam centers where the exam is conducted, they are known as Pearson VUE Center. There are multiple exams which are conducted at these centers. So when I went to my exam center, there were many people holding different exams, like some of them were appearing for the driving exam, driving license exam, and many more. So I was confused whether it is actually my exam center. So if you see someone who is not from your specialty or who came for another exam, then don't worry. This exam center is universal for different kind of exams. And this is the schedule. This was in 2024, but this is for 2025. The exam date will be 12th of November, and then the application period will start from 23rd July to 20th of August 2025, sorry. And adjustment deadline, the results will come after 4 weeks of your exam, and then finally 8 weeks after the result release, you will receive a diploma or certificate. Just to highlight that this exam, there are different exam centers for Pearson VUE. You can give exam internationally across UK, UAE, Saudi Arabia, Pakistan, India. So it's a global exam. Next one is the application process. So application process is pretty simple. You need to get yourself registered with the MRCP UK website. If you are already not a member of Royal College of Physicians, then make an account. There is an easy video of how to create an account on the official website of RCP as well. They will guide you through each of the step. And if you have already account, then go ahead from the MRCP UK your profile and select SCE Endocrinology and Diabetes. Choose your test center, whichever is located near to you. Pay your exam fee, which is usually almost £800, and then you can confirm the booking by receiving an email. You will receive an email first after your exam. After paying your exam fee, they will ask for some confirmation of your degree. Once you will pay that, you will receive confirmation email that your exam booking is confirmed. Then this is the website and the link where you can apply. Link for specialty certificate exam, you need to put exactly the same. And once you will go to the MRCP UK website, there are multiple exams with the name of SCE. You need to go to the Endocrinology and Diabetes and then see the format. This page will come in front of you. Then the exam format. This exam consists of 2 papers which are conducted on the same day, and this is, again I will mention, it is a computer based exam. So paper 1 has 100 single best answer questions. Likewise, paper 2 has 100 single best answer questions as well. Each exam lasts for 3 hours with a short break in between. Break depends on you. If you want to take half an hour, 1 hour, because this is computer based, whenever you will go to start the exam, it will last for 3 hours and then you can finish your exam. About the length of the questions, the questions are more or less similar in length to the MRCP exam, but they are more difficult than the MRCP endocrinology. And also the images are included, so be very careful while preparing for your exam. Prepare a lot of images, because like adrenal adenoma, then heart nodule, cold nodule, pituitary mass, there are many images coming in exam, so prepare the images very well. And about the complexity of the questions are not very difficult and not very easy. Some of them can be difficult, but most of them are in the range of passing, so an average range, not too much difficult. So prepare well, and you can go through the exam easily if you have enough preparation. This is the question distribution for the exam. Diabetes and diabetes mellitus diagnosis and general management has 28 questions, and 12 questions are from diabetic emergencies and acute management, which includes BK and HHS. So then the complication of diabetes, which has another 28 questions. So just imagine that 28, 56, and then 12, total of 68 questions are from diabetes only. And then is the thyroid has 36 questions as well. So 60% of the exams consist of diabetes and thyroid. Then is the hypothalamus and pituitary, which has 20 questions, and then adrenal disorders, which has another 20 questions, then gonadal disorder 24, parathyroid 16, and rest of the topics have 16 questions as well. So it's very important to understand that 60% of the exam focuses on diabetes and thyroid disorder. So prioritize these areas in your study plan. If you don't have enough time and you cannot prepare all the things, then at least prepare diabetes and thyroid very well. Unfortunately, this, I don't want to say this, but if you don't prepare diabetes and thyroid very well, then you are not going to pass the exam. So focus on them too much. And then adrenal, hypothalamus, thyroid, parathyroid, gonadal, other things are also very important if you want to get through the exam easily and have a good score as well. But first and foremost is diabetes and thyroid. The next is the time frame for study. So this is my personal time frame. If you are taking giving full time to the study, like 8 to 10 hours or at least 6 to 8 hours, then 2 to 3 months of intensive study would be sufficient for this kind of exam. But if you are like me, who is working full time, then you can take 5 to 6 months of routine study and daily at least 2 to 4 hours. But in the end, last 2 to 3 weeks, do intensive study as well. and then solve the mocks in between in order to stay in touch. Even if you have off days or breaks in between the exam, in between the preparation days, then you can solve mock in those days. The next is the study material. So study material consists of lots of things, like there are textbooks. It does not have any specific study material like past test, past medicine in the MRCP. It's not like that. Here, as you are giving a specialty exam, so there are lots of study material. You have textbooks, then journals, then conferences, then guidelines, online resources, and supplementary learning materials. So textbooks, there are multiple kinds of textbooks. The one I have used personally is this one, Oxford Handbook of Endocrinology and Diabetes, 4th edition I have used. 4th edition is the latest one, so I have studied all of it for my exam, honestly. And then there is another Oxford textbook of Endocrinology and Diabetes. I don't know which one is the latest edition, but do the latest edition. This is data I have taken from the MRCP official website of SCE. Then Williams textbook of Endocrinology and textbook of Diabetes, 4th edition. So this is the first and foremost with the latest guidelines and protocols followed in UK. Next one is the online resources. Online resources are also multiple. There is study PRN, then past test, on exam, single best MCQ book, then there is exam lab, diabetes bible, endotex up to date. So some of them are from my personal experience, and for some of them are from SC website as well. So this study PRN is first and foremost. I have followed this. I don't know if maybe some of them else have the same material as well, but I have followed this. I studied this 2 times before my exam. Then I was following some of the past test MCQs as well, especially MRCP part 2 and part 1 endocrine portion, and also some people are studying on exam, but I myself have not studied it personally. Then single best MCQ, this is also good to revise. Then exam lab, this is also very important because it has most of the questions from the previous exam. There is a diabetes bible, endotex, and up to date. So I have personally followed study PRN, single best MCQ, and exam lab. And also don't forget to solve the sample questions and pass. Then is the guidelines and conferences. So these are the important guidelines. If you are confused with some topics, especially from the textbook and also from the online study material of the MCQs, then go through the guidelines. It's very, very important. NICE guidelines, SIGN guidelines, National Institute of Health and Clinical Excellence is a NICE guideline. Then SIDE guideline. Then for thyroid is British Thyroid Association, Endocrine Society Clinical Practice Guidelines. Then there is JBDS. So the ones which I have followed is JBDS guideline, NICE guideline, BTA guidelines, and SIGN. These are very, very important. And then there is DVLA guidelines. Those are very important for the MCQs as well. Many MCQs are coming from DVLA portion as well. Then about the conferences, the most significant and important ones are Association of British Council Diabetologists, then Diabetes UK, Society for Endocrinology. These are very important. Then if you're still confused with anything, then go ahead with searching in these ones as well. American Diabetes Association, then US Endocrine Society, and European Association of Society of Diabetes and Study of Diabetes. Then this is the website for the sample questions. It's very, very important to solve the sample questions before appearing for the exam, because sample questions are more or less similar to the real exam. And once you have prepared for the exam very well, just go through the sample question in order to assess yourself as well as a mock, that how much you are well prepared. And if you score good, then go ahead. If you don't score good, then take some time to prepare well as well. So this is the website, and there will be again be consisting of best of 5, and I think this website has 80 to 85 questions with your samples. Then lastly but not least, supplementary learning through YouTube videos. I have watched loads of YouTube videos, especially Dr. Khalid Idris channel, although there are some things which need to be updated. That's why I said that for updated guidelines, go to the online guidelines as well as conferences. Don't follow anything blindly. You need to be updated because exam needs the latest guidelines and latest things. They are asking everything latest and up to date. So watch these channels to keep yourself to understand many things. Like in the thyroid, there are many things which are which need to be understood properly. If you don't have very good endocrinology experience and background, then go through these videos in detail in order to build your knowledge of endocrinology, and then start solving questions. So there, Dr. Khalid Idris, who is a professional endocrinologist from Egypt, he has very good videos on YouTube. In addition, there are short videos of Dr. Azhar. I have followed only the free version of him as well. So you can watch whoever you like. Then is the my study tips. Post exam I will tell after my study tips. So past papers are very very important. Practice as many past paper as you can. This is my own experience. The more you solve the MCQs, the more confident you are, and the more better you are at solving the questions. So at least solve 2000 to 2500 MCQs before appearing for the exam. Then follow the JBDS guidelines for diabetes. Focus on high yield topics. As I have mentioned earlier, allocate significant time for diabetes and thyroid disorders. Then use multiple sources. Stay up to date with the latest guidelines. Rotate between study PR and past test, exam lab, best of 5, on exam, and different sources of MCQs. Then sample questions and past papers are a must. Join study groups. There are study groups on the WhatsApp as well as Facebook, so you can join them and have a very dedicated study partner in order to stay motivated. And then finally simulate full mock exams and take full length exam under time condition in order to assess your capabilities. And engage with peers for discussion and support. Visual learning, utilize YouTube videos to reinforce complex concepts. Revise more and more with a study partner. Even last day revision is a good thing, because some things are very volatile, so very important topics have so much MCQs. While solving the MCQs, you guys will see that some of the things are very crucial, like thyroid nodule, and then the classification, and some things like HHS, DK, fixed rate insulin. So go through these topics in detail. All of these things are very crucial, as I mentioned. I am mentioning again and again so that you guys, whoever is appearing for the exam, will pass the exam like me in the first attempt. And finally, make flashcards for common topic. This is a mistake that I have made. I was making my notes, but I did not make the notes in a way that I can utilize them in future. So if you are making flashcards, that's very easy to revise the things at the end or in future. And one additional tip that I have found useful: consult with your colleagues who are already in the diabetes and endocrinology. Like I have ST4, ST5 colleagues who are with me in the same department, so I seek their guidance. I seek guidance from my consultants. They were very helpful. So seeking guidance is not an issue. Just seek guidance and just stay up to date and revise as many MCQs as possible. And then lastly, post exam expectations. Results are usually released 6 to 8 weeks after the exam. Successful candidates will receive an SCE certification, not MRCP. It is SCE certification after 8 weeks, which is from the Royal College of Physicians as well. That's why they are associating it with RCP, and it will boost your international job prospect. So if you found this video helpful, and if you have any questions or comments regarding the SCE exam, please don't hesitate to ask in the comment section. And if you need any study material, I am happy to help. Don't forget to like, subscribe my channel, and you can ask questions on my official Instagram as well as in the comment section, and I can help you guys with the study material as well. I will try to attach the study material in the description box. Thank you so much for your time. Best of luck. Go and crack your exam in the first attempt. Bye bye.